Sir, thank you so much for joining us on BW Healthcare World. This is the 8th edition of CAHOCON. What is the change that you have seen from the first time that CAHOCON happened to today in Kolkata when it's the 8th edition?
Very good question in a way, because it's like seeing a child growing from being a newborn to somebody who is now going, actually was supposed to go to class 7th or 8th, but suddenly we see that as if we are already entering the university. So I would say in the first year or so, it was more like, you are organizing a conference and we are trying to collect people to whom we are supposed to talk something about patient safety and quality. But when you come to the 8th year, we are seeing it has become a big family in our country, and we have even crossed the boundaries, and we get people who are coming from international organizations. And also the event is endorsed by a body like ISQA, ESQA, and Quality Council of India. Now this endorsement from ISQA, for example, which is the International Society for Quality, and they deal mainly with the accreditation bodies. I am not sure that there are many other non-accreditation bodies with whom ISQA has such a intense relationship. So now, for example, for the last more than 3 years, we hold a webinar by a ISQA expert on every first Tuesday of the month at 5 p.m., which is being attended by people from more than 20-25 countries. So now, idea is that the family is really becoming large, and every year you see at least now similar same faces also. Some new people are coming. We are getting the same people who are sponsoring us. Some more are joining. So the family is enlarging. The discussions are becoming more meaningful. They are becoming more impactful. And we are really very, very, I would say, happy that God has been kind, and I think the country is giving a lot of love to CAHO and to the events like CAHOCON and CAHOTech.
No, this is very nice. In fact, I've been attending the sessions for the last 2 days, and one thing that I've observed is that the conversations are going beyond quality but are centered around quality. There are a lot of conversations that are getting triggered here. And also what I observed was that you have launched a few international forums, right? We have always been seen as a country which is developing, and we will follow what is happening globally. Do you think it is the right time where India can go and prove that, we will set these standards and let the world follow? Are we going there?
You see, one thing for sure that we used to look up to United States for the quality movement in healthcare. Because let's say a accreditation body like Joint Commission is the one which has been more or less copied, emulated in different avatars by different people.
Correct.
But even after 75 years of their existence in that country, and they are spending money on healthcare which is equivalent to the GDP of our country, we find that preventable medical errors are the third leading cause of death in that country. So one can easily imagine what must be happening in our country. So we do not have, of course, the data. So we feel one thing is that accreditation has definitely played a huge role in sensitizing us to the issues of patient safety. At least we are now talking about it. We are understanding that this is an issue, and it is definitely, it has been a great help. But to make an impact, we have to move beyond the confines of the accreditation. And the lacunae that we find, what is it that we have to move beyond? One is that our clinical leaders, clinicians, have to come forward and embrace these concepts. You see, practice of quality in cardiology or orthopedics or pediatrics can only be first of all done by this department, their heads, not by the quality manager.
Right.
The emphasis of the accreditation bodies are totally on the quality managers and the administrators. But these departments, they need to be brought in, and that's a very difficult nut to crack. Somehow we have to work on how do we make clinicians come to the fold of quality. Second is that we have been ignoring patients as a partner in healthcare.
Correct.
So that's another one where at CAHO we have now formed this Patients for Patient Safety Foundation. We had started with Patients for Patient Safety initiative, and therefore we are trying to sensitize patients as to how should they ensure their own safety by saying my health, my responsibility.
Correct.
And third is that in healthcare, it's not merely the doctors and nurses. So we have to not forget about the engineers, the pharmacists, the rehab specialists, the dietitians, and many more. So the thing is that we have now created these forums. And fourth is that we need to talk about good practices rather than merely cracking the code of getting the accreditation. So I think all that combined, we can lead, I will say, the world, because what CAHO has created is a very unique experiment of bringing the healthcare institutions and the individuals together in a diverse country like India. 10 years
Absolutely.
back, there was, you could not imagine that I would know anybody in Tamil Nadu, or the people from there are doing some work together with a person in Indore or Nagpur. So this has been a phenomenal thing of breaking the silos, and I think it is the right time that we have launched now CAHO International, where we are aggressively, means in a constructive way, we will go and talk about our services and products so that they can also emulate the same thing.
Fantastic. And sir, my last question to you is, we've been having a lot of conversations in the past as well. And we've spoken that quality has to become a culture. It is not one tick off that is there in the hospital. For building a culture, the mindset of the people have to change. In the last few years, have you seen this change in the way people think of quality and their role in the hospital towards what they can do towards quality?
I think it is changing. It is definitely, there is a change. The first change that has to happen is that, as I said, accreditation has been the major driving force, and that has been accepted by the community. But you see, most hospitals feel as if the day they get their accreditation is the end of their quality journey, while that should be the beginning of their quality journey. So that is the first change that is needed to build a culture of safety. Second, as I said, is to reach out to all the stakeholders, everybody in the healthcare institutions. Third is that the people have to start demanding quality. You see, unless this need of the community will start demanding more and more of quality, rather than only reacting to something wrong that has happened in a hospital. Let's also understand that, as I said, what is happening in a country like United States with the kind of errors, to think that there will be no errors in any hospital is not really a practical way of thinking. The only way we have to learn from the mistakes, and I think the community needs to demand more quality, both from the government and from the private sector, and I think that's where it will change.
Absolutely. In fact, one of my biggest takeaways from one of the sessions yesterday was that we have to move from customer centricity or a patient centricity to patient driven. I think that's the objective, and I think that's where CAHO is moving. Thank you so much for joining us for this conversation, sir.
Thank you, Harbinder.